All right, so we're diving into some fascinating stuff today, and I got to say this one number really caught my eye. It's estimated that the global healthcare industry loses something like $455 billion every single year. And the culprit, inefficiencies. It just makes you think, right? Like, what could we achieve if we just, I don't know, redirect those funds? But even more than the financial side, imagine if we could actually use like really advanced technology to not just fix those inefficiencies, but also like seriously improve the quality of care that people receive.
Yeah, you hit the nail on the head there. And that's where this whole idea of agentic AI comes in. It's not just a minor tweak. Everything we've been looking at suggests it's more like a complete transformation of how healthcare works, both from the patient's perspective and the way the whole system is managed.
Totally. Today we're going deep on agentic AI. And we're not talking about your run-of-the-mill AI that needs someone holding its hand every step of the way. This is about intelligent systems that can, within healthcare settings, actually assess situations, make decisions based on what they see, and then act on their own, all to reach specific goals. It's a whole different ballgame.
A good way to think about it is like traditional AI is like a really helpful assistant, but you need to tell them exactly what to do for every single task. Agentic AI, though, has this level of independence. It can take in information, process it, decide what needs to be done, and then actually interact with the healthcare environment to get things done.
And this is important. It's not about replacing doctors and nurses. It's about making them even better at what they do. The National Center for Biotechnology Information actually makes this point pretty clear. It's about AI taking on some of the load so that these highly trained professionals can focus on, the really complicated cases. And let's not forget that human connection with patients, which is so vital.
This makes you wonder, right? Like, why is this happening now? What's changed?
Well, a lot of it comes down to two really important technologies. First, we have LLMs, large language models. That's the same stuff that powers things like ChatGPT, right? These models are all about helping AI understand and generate text that sounds, well, human. And that opens up so many possibilities in healthcare, particularly for how we interact with these systems.
Right. So we're talking about an AI that can read a doctor's notes, which are, let's be honest, not always the easiest to decipher, and then turn around and write up like crystal clear instructions for a patient, all in a way that feels completely natural and conversational.
Exactly. And then you've got multimodal foundation models, which is super interesting. They can handle all sorts of data, not just text. Think medical images, x-rays, scans, recordings of a patient describing their symptom, the whole works. This gives AI a much deeper, more comprehensive understanding of what's going on in any given healthcare situation. Okay, now for the really cool part. We're not just talking theory here. The stuff we've been reading outlines some genuinely game-changing applications. We're talking about things that could really tackle some of the biggest problems in healthcare. Like, could this actually speed up drug discovery, which can take, like, forever, right? Or maybe even get us to a point where diagnoses are incredibly precise. It's pretty mind-blowing.
Yeah, it is. So to really get this, we need to understand what agentic AI actually does in healthcare. At its core, it's about taking action on its own, making decisions based on the data it's looking at, and then actually working within the healthcare world to get things done. AI with initiative, right?
And like we said before, this isn't about replacing anyone. It's about giving those amazing clinicians, the doctors and nurses, even more tools and support.
LLMs are a big part of that. They're like the bridge. They help healthcare professionals talk to these AI systems in a way that feels normal, like asking a colleague a question. And they get back answers they can actually use.
And those multimodal foundation models we were talking about, by pulling in all that different data, they're able to paint a much clearer picture of what's going on. It's like, imagine an AI that has access to your entire medical history, your latest test results, even how you describe feeling during an appointment. It's like having the most thorough medical detective working on your case.
So how does this actually play out in the real world? Let's start with diagnoses. Agentic AI can go through huge amounts of medical images. Think about all the X-rays and MRIs taken every day. It can compare those with a patient's medical history, all the latest research, and look for the tiniest patterns and anomalies that a human might miss.
So it's not just a doctor looking at a single scan, right?
Mhm.
The AI is comparing it to like a massive library of information.
Exactly. And that means more accurate diagnoses, which of course leads to earlier and more effective treatment. It can even improve the whole experience for patients, knowing that AI is working in the background to make sure nothing gets missed. I mean, that's got to give you peace of mind, right?
Oh, absolutely. Now let's talk about personalized treatment plans.
Yeah.
This is where things start to feel almost futuristic, but it's happening now, isn't it?
It is. Agentic AI can look at a person's unique biology, their genes, their lifestyle, their entire medical history, and then it tailors a treatment plan just for them. A whole new level of personalized medicine.
So no more one-size-fits-all treatments. It's like, here's a plan designed specifically for you. It's got to be more effective and hopefully with fewer side effects.
Exactly. The research highlights how this can impact everything, from how well the treatment works to predicting possible side effects, even figuring out the perfect dosage and helping patients actually stick to their treatment plan. This kind of tailored care is a huge leap forward.
And let's not forget about the mountain of paperwork in healthcare. How does agentic AI help with all that?
This is where we see huge potential for saving money. Agentic AI can automate a lot of the administrative stuff, things like scheduling appointments, dealing with insurance claims, and even making sure resources are used efficiently.
So nurses and admin staff can spend less time on paperwork and more time actually caring for patients. That's got to improve morale too, right?
Absolutely. And on a bigger scale, all those streamlined processes mean lower costs for healthcare providers. It directly affects what they call OPEX, operational expenditures, which is a big deal for anyone looking at the bottom line.
Okay, now this one really intrigues me. Predictive healthcare. How does agentic AI go from simply reacting to illness to actually predicting and maybe even preventing problems?
It's all about analyzing tons of data, both from individual patients and entire populations. Agentic AI can pick up on subtle patterns and connections that might point to a higher risk of developing certain conditions, or even predict when an infectious disease might start spreading.
So like it could spot a spike in a certain illness in a specific area before it turns into a full-blown outbreak. That's wild.
Precisely. And if you can identify individuals who might be at higher risk for something, healthcare providers can step in early, recommend preventative measures, and ultimately keep people healthier while lowering overall healthcare costs.
Now for the big one, drug discovery and development. This process is notoriously long and expensive. How does agentic AI change that game?
This is where it gets really interesting. Agentic AI can analyze huge databases of molecular structures, predict how different compounds will interact with the body, and even simulate clinical trials, all in the computer, what they call in silico testing. What's game-changing here is the potential to drastically shorten the time and the huge expense of bringing new treatments to market.
That's massive, not just for pharmaceutical companies looking to save time and money, but for patients who could get access to life-saving treatments much sooner. And the sources really emphasize this. It gives those companies a big advantage.
Okay, we've talked about how agentic AI can change specific areas of healthcare, but now let's zoom out and look at the big picture, the benefits for the entire healthcare system.
All right, so what are the overall advantages? I mean, improved patient outcomes have to be at the top of the list, right? That's the whole point.
Absolutely. And agentic AI contributes to that in a bunch of ways. By analyzing medical images and electronic health records, it can help us detect diseases much earlier and more accurately, allowing for proactive interventions and timelier diagnoses.
So catching something early, like a tiny blip on a scan, could make a huge difference in the long run.
Exactly. It also means more effective treatment plans because, remember, AI can personalize care based on a deep understanding of each patient. So it can recommend the best treatment options and even anticipate possible side effects.
Which makes patients more likely to actually follow their treatment plan, right? If you understand why you're doing something, what to expect, you're more likely to stick with it.
The second big benefit our sources highlight is how much more efficient and productive healthcare professionals can be. We touched on this with the administrative stuff, but it goes way beyond that.
Yeah, so if doctors and nurses aren't bogged down with paperwork and scheduling, they have more time and energy for what really matters, their patients.
And that, according to the sources, translates into a smoother running system overall, and let's not forget, it can really help with burnout and job satisfaction among healthcare staff. Which, again, feeds back into those OPEX improvements we were talking about, keeping things financially sustainable.
Cost reduction is always a big topic in healthcare. How does agentic AI help bring down those sometimes astronomical expenses?
There are a few key ways. Making sure resources are used efficiently is crucial. AI can help hospitals and clinics make the most of their staff, equipment, and everything else, making sure things are available when and where they're needed. Then there's the improvement in treatment outcomes, people recovering faster and needing less long-term care, which obviously saves money. And of course, all that streamlined administrative work we discussed earlier, that plays a big role too.
The sources even gave this cool example of AI being used for predictive maintenance of medical equipment. So instead of waiting for something to break down, the AI can anticipate problems, prevent downtime, and avoid those expensive emergency repairs. That's a smart use of technology, right?
Absolutely. Another really important benefit is better access to healthcare, particularly for those in underserved or remote areas. That's where the power of AI to reach across geographical barriers becomes really transformative.
Definitely. Telemedicine has made a difference, but agentic AI can take it to a whole new level. It can enable much more sophisticated remote patient monitoring and help with those virtual consultations. It's like bringing essential healthcare services to people who might not otherwise have them.
It can truly enhance those telemedicine services, extending the reach of healthcare providers and making the whole system more equitable.
Finally, there's the potential for agentic AI to accelerate research and development in healthcare, and that's where future breakthroughs are going to come from.
Absolutely. By sifting through massive amounts of research data and patient information, AI can spot patterns and connections that human researchers might miss. That means faster drug discovery, development of highly personalized treatments, and more efficient clinical trials.
Leading to quicker progress and more effective therapies, which, as we've discussed, is a win-win for pharmaceutical companies and research institutions. More speed, more efficiency, and a real edge in that competitive landscape.
So the potential benefits are huge. But, like with any big technological change, there are some challenges that come with implementing agentic AI in healthcare. We need to address those strategically.
One statistic that really jumped out from the research is that around 85% of AI projects fail because of problems with data quality or not having the right kind of data. It's a good reminder that this isn't a simple plug-and-play solution. So what are some of the other big hurdles?
One of the biggest is this tendency to go for what we call point solutions. It's like a healthcare organization adopts a bunch of different AI tools, each one designed for a very specific task. And while that might seem helpful in the short term, it can lead to a messy system where things are fragmented, different departments are doing the same work, and ultimately, you're not getting the most out of your AI investment.
It's like everyone's working in their own little silos, right? Each
Mm.
department with its own AI gadgets, but no overall plan.
Exactly. And that lack of coordination often leads to the second big challenge, which is showing that AI is actually delivering value, making a real difference. A lot of AI projects struggle to show clear benefits, and that makes it really hard to convince leadership, especially those who control the purse strings, to keep investing in this technology.
It's like if you can't prove that it's worth the money, it's hard to get people on board, even if the idea seems promising.
The third challenge is getting everyone on the same page within a healthcare organization. AI initiatives often need input from different departments, doctors, IT folks, administrative staff, and making sure everyone is working together towards the same goals can be tough.
Yeah. Getting everyone to sing from the same hymn sheet in a big, complex organization like a hospital is never easy.
Then there's the issue of finding the right people. There's a global shortage of data scientists and AI engineers, especially those who really understand healthcare. That can force organizations to rely on outside consultants, which can be expensive and might not be the best long-term solution.
And finally, we come back to the foundation of it all, data. If the data is bad, or if you don't have enough of the right kind of data, or if the AI is a black box where no one understands how it's making decisions, that's going to lead to problems, inaccurate predictions, and a lack of trust.
You're absolutely right. Those are some serious challenges, but the good news is that our sources also point to some possible solutions and ways to overcome these obstacles. To tackle that issue of too many point solutions, we need a strong, centralized approach to AI governance. That means getting everyone aligned, prioritizing projects based on the organization's overall goals, and making sure we're not wasting resources by duplicating efforts.
So more strategic thinking, less piecemeal adoption.
Exactly. To show that AI is actually delivering value, we need to be very clear about what we want to achieve. Define specific objectives, what they call KPIs, key performance indicators for every AI project. We need to be able to track progress, measure results, and show that the investment is paying off.
Prove it works in a way that everyone understands.
And we can't forget about the data itself. We need to invest in building a solid data foundation, things like data lakes and pipelines, and make sure we're really focusing on data quality.
Garbage in, garbage out, right? The AI is only as good as the data it's working with.
To solve the talent shortage problem, healthcare organizations need to start training their existing staff, building their own internal AI teams, and creating a culture where everyone understands data.
It's about empowering your own people and becoming less dependent on outside help.
And to build trust in AI, we need to make sure we're using high-quality, relevant data and developing AI models that are transparent, where you can understand how the AI is reaching its conclusions. The sources even specifically recommend exploring what Google Cloud has to offer in terms of AI and machine learning platforms and services.
So it's a multi-pronged approach. Strategic planning, data infrastructure, talent development, and building trust. It's a big task.
As healthcare organizations start to navigate this new world of AI, a clear and comprehensive strategy is key.
It's not just about buying some fancy AI software and hoping for the best. You need a solid plan.
Exactly. The first step is to figure out what you want to achieve with AI and make sure those goals align with the organization's overall mission, whether it's reducing hospital readmissions, streamlining those crazy administrative workflows, or speeding up drug discovery. Those clearly defined goals are the foundation of your AI strategy.
You got to know why you're doing this and make sure it's connected to the bigger picture.
Next, you need to build that strong data foundation we talked about. That means taking stock of your data situation, making sure it's accurate, relevant, complete, and accessible. And dealing with those data silos where information is trapped in different departments is crucial.
You can't build a house on a shaky foundation, and you can't build a successful AI system on bad data.
Partnerships are important too, both internal and external. Working with companies that specialize in AI solutions, like 66 Degrees, who were mentioned in the research, can be really helpful. They have the expertise to tailor AI to the unique needs of healthcare. And internally, it's about making sure doctors, IT specialists, data scientists, and everyone else is working together.
You need buy-in from all the stakeholders, right?
What?
Make sure the AI solutions actually address the real problems people are facing.
And especially in healthcare, you absolutely need a strong ethical framework. This is about patient privacy, data security, and making sure everything is done by the book. We need clear guidelines for using AI ethically, robust cybersecurity measures, and compliance with all the relevant regulations. And we can't forget about potential biases in algorithms, the need for transparency in how AI makes decisions, and clear accountability for what AI does. These are things we need to address head-on.
Trust is everything in healthcare, right? And a solid ethical framework is how you build that trust.
To keep the momentum going, you have to be able to show that AI is making a difference. Define those KPIs, those key performance indicators for each project, and track your progress, show the tangible benefits, both for patient care and for the organization's bottom line.
You need to be able to say, look, here's what we invested, and here's what we got back. Make it clear.
And lastly, we have to remember that AI is constantly evolving. We need to be ready to adapt, review our strategy regularly, and refine our approach based on what's working, what's not, and what new technologies are emerging. Creating a culture of continuous learning and improvement is key.
It's not a one-and-done deal. It's an ongoing process.
So to wrap things up, bringing Agentic AI into healthcare is a huge step forward in our quest to deliver better, more personalized, and more efficient care.
And it's not just about adding a few AI tools here and there. It's about transforming the entire system.
We've talked about AI-powered diagnostics, personalized treatment plans, and predictive health modeling.
All of this is built on that strong foundation of good data management and secure cloud infrastructure.
So here's something to think about as we move forward. How will the combination of increasingly intelligent AI and the ever-growing sea of data in healthcare continue to change not just how we experience healthcare, but the very nature of medicine itself? That's the big question.
It's a brave new world out there. Thanks for joining us.
It's been a pleasure.